The freshman 15 is the butt of many jokes, but eating disorders for college freshmen is no laughing matter. We speak with an expert on what parents need to look out for this time of year. Welcome back. With the holidays right around the corner, many college kids are coming back home for the first time since leaving for school, and things have changed in our children, both mentally and physically.
Yeah, our next guest is here to remind us what to keep an eye out for when our kids take a seat at the Thanksgiving table. Dr. Dara Bushman joins us now. And Dr. Bushman, this is really important because, you know, everyone jokes about the freshman 15 when kids go away to college, but it's no laughing matter, especially if you haven't seen your kids for a few months.
No, not at all, because they've gone and you're only hearing what they're reporting, and sometimes communication is a little broken, especially at first when they're completely overloaded with the excitement, meeting new friends, getting into new eating patterns, and meeting alcohol.
Yeah.
Things really shift around a lot, and even at first, a lot of kids aren't even aware of what's going on. Perhaps they had some maladaptive patterns when they were at home, and then they get to school and emotion starts going wild, and maybe they're given a food plan and unlimited amounts of food, and unfortunately, a lot of the food plans are processed food.
But the reality is, too, a lot you're in your feelings. I'm going to quote Drake when he went with that one. But you do get in your feelings when it's a new environment and you start building anxiety, and what leads to that is eating, right? You overeat.
Completely comfort food, and if they're eating the processed food, they're going to be even more to start eating it, and if they're drinking, then their
both of it.
Exactly, neurotransmitters are being numbed out, and they're not quite sure what's going on, and so they're eating, and they're putting on weight. And what does everybody do when they feel guilty about eating a piece of key lime pie? They go eat another piece of key lime pie. Right, so
what should we look out for?
What are the things that parents need to look out for in our kids?
Well, number one, you wouldn't know about weight until you see them, but if you're seeing an extreme increase in weight, would definitely be something. Irritability, mood changes, strong shifts in their actions and behaviors. If they're not talking to you at all, if you're seeing them increasing with the drinking, sadness, isolating, all of a sudden they don't want to do social things that they used to want to do, is really a big piece of it, where they're embarrassed to go out, or all of a sudden they come home and they need a whole new wardrobe. And then they're spending an absorbent amount of time after eating in isolation by themselves in the bathroom, asking a lot of questions that seem a little bit odd. But most importantly, it's for us to talk to our kids, really connect with them, communicate, ask them what's going on, and don't be scared. A lot of parents think, I just won't ask and I'll just wait and see what they tell me.
Well, the problem is that there's a pushback with them. So how do you even start that conversation if you haven't seen them for you haven't seen them for a couple months? The last thing you want them to do is run out the door.
Yeah, well, don't comment on the weight. Definitely don't comment on the weight first and foremost. But you know, they're young people too, and don't just think that this stops at women. This stops at young men too. The stigma is that it only is affecting women. And I mean, it's scary to tell you that probably about 25% of teenagers are being affected by eating disorders. Wow. And eating disorders is the highest mental health that's causing suicidality and deaths. So talk to them, connect, communicate, and be direct.
All right, Dr. Dara, thank you so much for being here. For more great tips from Dr. Dara, you can head on over to NBC6.com/6inthemix. We'll be right back.